Psychopath, sociopath. We hear these words thrown around all the time, right? In movies, on the news. They're used to describe some of the most chilling figures, real or fictional. But what do they really mean? Today, we're going to cut through all that noise and get to the real science behind these powerful labels. So, think about it. When you picture that cold, calculating villain who's always 10 steps ahead, is that a psychopath or a sociopath? What about the impulsive, hot-headed criminal who just lashes out? It gets confusing fast. But figuring out the difference is actually pretty crucial. So let's start by getting the terms straight. Okay, here's the first big surprise. In a real clinical setting, a psychiatrist is never going to officially diagnose someone as a psychopath or a sociopath. Nope, those are not official diagnoses. Instead, both of these profiles fall under one big clinical umbrella: antisocial personality disorder, or ASPD. It's the official term for someone who consistently disregards and violates the rights of other people. Now that we've got the official clinical term, let's move beyond the Hollywood stereotypes, because that's where things get really interesting. Even though they're not official diagnoses, researchers and clinicians find the distinction between the classic psychopath and sociopath profiles incredibly helpful for understanding what makes someone tick. In the scientific world, they actually talk about it in terms of primary and secondary psychopathy. It's a bit of a mouthful, I know, but for our purposes, just think of it this way. Primary psychopathy lines up with that classic psychopath profile we all know, and secondary psychopathy, that's our sociopath. Using this framework helps us get past the stereotypes and really dig into the differences. So, let's do it. Let's put these two profiles head to head. What really separates them when you look at their emotions, their behavior, how they operate in the world? We're going to start with primary psychopathy, the one that probably pops into your head first. First up, primary psychopathy. This is the profile of that smooth, manipulative person who can seem so charming on the surface, but underneath, there's a chilling emptiness. They are masters at blending in. And when you look at the key traits, you see why. There's a deep, profound lack of empathy. They don't feel your pain, but they hide it behind this mask of charisma and charm. They have incredible self-control, which makes them dangerously calculating and manipulative. And here's the kicker. This seems to be rooted in biology. We're talking actual differences in the brain, like an underactive amygdala. That's the brain's fear and emotion center. They're just wired differently. All right, now let's flip the coin and look at the second profile, secondary psychopathy, or what we more commonly call the sociopath. And trust me, this is a whole different ballgame. This profile isn't about being cold and calculating. It's defined by chaos and emotional storms. And the contrast is just, wow. Where the psychopath is controlled, the sociopath is impulsive and erratic. They're buzzing with anxiety, and their emotions are all over the place, which can lead to these sudden, explosive fits of rage. They can sometimes form attachments to people, but those relationships are usually a total mess. And here is the single biggest difference. This profile isn't born, it's made. It's believed to be rooted in environmental factors, like severe trauma. And that right there leads us to one of the biggest debates in all of psychology: nature versus nurture. Are these individuals born this way, or are they a product of their environment? Well, it looks like the answer is, it depends on which profile you're talking about. For primary psychopathy, the classic psychopath, the evidence points overwhelmingly toward biology. I mean, studies of twins and adoption suggest that genetics can account for a massive 40 to 60% of these traits. That means there's a powerful genetic push shaping their brain from day one. But for secondary psychopathy, it seems to be a story written by their environment. Things like a chaotic home, physical neglect, or serious childhood abuse and trauma can basically shape a developing brain towards this kind of volatility and antisocial behavior. They weren't born this way, they were hammered into this shape by life.
Okay, so you've got these two totally different origins, right? One is mostly biological, the other is mostly environmental. And as you can probably guess, that leads to two very, very different ways of behaving in the world. Let's break down how that actually looks.
This table just lays it all out so clearly. You look at emotions, you've got controlled and superficial versus impulsive and volatile. For behavior, it's calculated and planned versus erratic and rage-prone. Socially, one can blend in perfectly, even seem charming, while the other just can't keep it together. And the origin story? Born versus made. So here's the bottom line. One is a predator who has learned to mimic human emotion, while the other is lashing out from a place of deep pain and instability. So after hearing all that, you have to ask the really important question. Can anything be done about it? Is there any hope for treatment or change?
And I'm not going to sugarcoat it, treating antisocial personality disorder is one of the toughest nuts to crack in all of mental health. A huge reason is that these individuals almost never think there's anything wrong with them. In clinical terms, their traits are egosyntonic, which is a fancy way of saying they see their behavior as a perfectly normal part of who they are. And if you don't think you have a problem, why would you ever want to change?
But that doesn't mean it's hopeless. There are some promising strategies out there. The absolute best approach is early prevention, working with at-risk kids and families. For adults, things like cognitive behavioral therapy, or CBT, can help them learn to manage their impulses. And then there's something called schema therapy, which goes really deep to try and fix the messed up beliefs formed during childhood, which, as you can guess, is especially helpful for the secondary psychopathy profile. So, after all this, you might be wondering, why does this distinction even matter? If they both fall under the ASPD diagnosis, why do we care if someone is a psychopath or a sociopath? Well, it matters a lot. Let's boil it all down. First, remember that psychopath and sociopath are really just easy ways to talk about two very different profiles under the same ASPD diagnosis. Second, their origins are different. One is largely born, the other is largely made. That difference leads to dramatically different behaviors, the cool, calculating predator versus the hot-headed, impulsive reactor. And this is the most important part. You have to understand the cause if you ever want to have a chance at creating prevention or treatment that actually works. And that leaves us with one last, really challenging thought to chew on. We've seen just how much of this behavior can be traced back to genetics or to deep, profound trauma, things that are way outside of a person's control. So if that's true, it really makes you wonder, where does personal responsibility for our actions actually begin? It's a complicated question, for sure, with no easy answer, but it's definitely one worth thinking about.